Growing up in Accra, Ghana, things weren't as sophisticated as we have now. There were no mobile phones, there was no internet. And then I saw my very first computer in 1998. My dad bought the computer from an auction at the bank where he used to work. And that is how really my passion for computers started. We then had internet at home where we were using dial-up. Typically, you hear the noise when it's trying to authenticate and connect. It was amazing. I just fell in love with it.
He was very, very, very happy. And I realized that he knew about the computers more than I did.
Daddy, this was this.
So this is a floppy diskette. These are type of drives we used to use. Computers have really evolved since the 1990s. These days, chips are becoming so powerful, yet so small, that you can even put in your pocket. There are lots of cool stuff in here. Those times, if you play music, you slot this into a cassette. If you want to rewind it, you can put what do you call it? You can put your pencil and then you move it like this. I've always wanted my work to have a positive impact. And so currently, I work as a project manager with Simprints, a biometric technology company that is working in Ghana to help create unique identities for people to ensure that they can have access to better healthcare. I love to visit the field very often because that is where I get to see the technology in use. It's estimated that close to 850 million people around the world do not have any form of identification. In the case of Ghana, especially in our rural areas, it is very common that children have no medical ID. This means that tracking vaccines and medical supplies could be very difficult and could potentially mean that a child will not get access to treatment on time. At the moment, close to 14 million children around the world are missing out on vaccinations. Our biometric solution focuses on creating unique identities for clients to help alleviate the use of paper-based reporting, especially when it comes to tracking patients.
The benefits of the facial biometrics is that we are able to track and register and then have the information of all the patients and our clients. In the case of child welfare clinics, we're able to know the quantity of vaccines we need for a section and which vaccine the child is coming to take, and then do follow-up visits in case a child misses a weighing session. So it makes work much easier.
Fidie no aboa me ne me ma. Abere ne abibi ebekọ clinic ho no. Bekọ na me nsa ekosi so a information ni nyina eba. Ama mo hu de mbeya na bosome na etwa mu no. Na ma yi no ma hwe me ne nkwala no. Sempo ya card na yela ne yekọ a na me nsa ne kosi so a information ni nyina eba.
At Simprints, we have advanced security standards, protecting people's personal data from the point of capture to its place of storage. It is important to have both the facial and the fingerprint biometrics because we are able to accurately identify or verify the client. With the support and hard work of the community health workers who are working at the last mile, we are going to support the tracking of all the 4 doses of the malaria vaccine, which are all essential to ensure the success of this program. By using biometrics, we'll be able to tell who has received which vaccine, who needs to receive a reminder to come for the vaccine, all to ensure that no child is missed out. Let's look out for this and let's be very positive about it.
I think he's doing a very good job. He goes out, when he comes back, tells me, the idea is being taken up by the health workers.
I am very happy that my children have more opportunity than I had back in my day. They have access to digital IDs, and so it's likely they will not miss out on any form of vaccination, which is excellent for me. And I'm very happy and passionate about being part of the solution to this problem, not just in Ghana, but all over the world.